Are you here to see somebody about some hair?
I absolutely am.
Well, you're at the right place and I'm the right person. So I'm Dr. Angie Phipps.
Jamie, it's nice to meet you.
Nice to meet you too. So it's always good to put a face to a patient. So in the age of COVID, I like to meet my patients outside so I can see them before we mask up. So we're gonna head upstairs where we can examine your scalp.
Sounds great.
The world perceives men losing their hair as a natural process, and it's not anything that people question. When women lose their hair, it's something that people question, and it can be a much more of a psychological issue for women than it is for men sometimes. So when men go from male to female, it becomes super important for them to be able to establish that hair as their identity as a female.
Okay, so now I actually need to evaluate your scalp and check your donor area to see if you're even a candidate for surgery. A hair restoration procedure is essentially taking hair from the back of the head, which is the donor hair, and replacing it into the balding area.
To do a hair transplant, I will surgically remove a specimen out of the back of the head. That tissue will then be passed off to my technicians who will dissect each hair follicle individually out of that specimen. Then I will make individual incisions at the right angle, direction, and orientation that I want the hairs to grow, and then implant each follicle one by one.
All right, so what I'm gonna do now is I'm just gonna look at your donor area.
I really want to do this procedure for Jamie, but until I evaluate her donor hair area, I just don't know whether we're gonna be able to do it.
All right.
Jamie is a transgender female who has experienced male pattern hair loss. In all other aspects of her life, she feels like she's accomplished being her true self. However, there's this one issue of hair loss looming over her bald head that she wants to see if she can address with the hair restoration procedure.
One of the constraints with you for hair transplantation is you've got a small head.
I do.
And so I can only take out a certain amount of tissue, you know, because you got a small head. So we'll see what we think that density will yield us.
Best case scenario for Jamie is I would like to be able to harvest 3,000 grafts, but just given the overall smaller size of her head, I don't know if that will be possible.
My own family members have suffered from hair loss and have underwent the procedure. So my litmus test with patients is if you're my sister or you're my cousin or you're my best friend, would I recommend a hair transplant to you? And if the answer is yes, we're gonna move forward with you. And if the answer to my family member would be no, then we're not gonna move forward with you either.
This is my one and only chance. Otherwise, it's wigs for the rest of my life. And if it's just wigs for the rest of my life, I will feel like I will never be whole. That I am always dressing up to be a person that I'm just supposed to be.
But I do consider you a very good candidate for surgery.
I am super excited.
Yay!
Coming into all of this, my biggest fear was just straight up that it wasn't going to be able to happen. That she was going to say, you have too much loss, there's not enough that we can do for you. And now that we've gotten to this point, I just feel like I'm going to be able to just be normal. And that's all that I want.
All right, let me put some glasses on and we're gonna get started in creating the generalized shape of the hairline and then we'll get started, okay?
Absolutely.
Okay, all right.
I'm a bit anxious. I mean, just the idea of having my back of my head torn open and things shoved in the front is a little disconcerting, but I absolutely trust in her skill and put myself fully in her hands.
So you should just feel me touching you and some pressure, but nothing sharp, okay? So it's a superficial, what we call skin surgery. Patients will sometimes say, do you get to see my skull? And I'm like, if we see your skull, I'm calling 911.
I'm going a little deep there.
We've started Jamie's surgery, and I'm about to remove a piece of specimen out of the back of the head, and that's where all the hair follicles are located. And because Jamie suffers from male pattern baldness, and she's got kind of a relatively small head, every hair follicle is important, so I have to be so precise that I make sure that my cut is made at the angle that the hair follicle is exiting the skin so that I don't damage or transect the follicle. Because if you transect them, they won't successfully grow. I'm just trying to keep hair alive, people. Now, Jamie, are you a looker?
I am a looker.
You ready? Look at that.
Absolutely crazy.
Isn't that amazing? You see those little tiny black dots?
Those are
That's
the
the root
follicles.
of the hair follicle that resides in that fat.
It was a pretty awful thing to look at with the hairs sticking out, and the fat layer on the bottom was extremely gross and a little daunting. So with that strip that just got pulled, what's happening with it right now?
So I passed that strip of tissue with the hair follicles in it off to my technicians.
Right.
So they're gonna dissect out each individual hair follicle one by one.
Sounds tedious.
We call it artistically meticulous.
All right.
That sounds better.
For sure.
Yes.
I am so nervous that it isn't gonna be enough follicles to have a full head of hair.
Okay, Jamie, I'm gonna start making the little incisions. I'm now going to make the individual incisions where the follicles are going to be placed. So this is the time to be as precise and meticulous as possible and not just go in there in any haphazard way, because anybody can take a scalpel and make incisions into the scalp. But it's about paying attention to the right angle and direction and orientation that the hairs would have been in their native state.
Sounds like a pencil and paper.
All right, Jamie, we are finished cutting all the grafts. The number that we harvested was 2,860.
That's pretty good.
That's really good.
I didn't get the 3,000 grafts that I was hoping for, so there might be some concessions that we have to make along the way. But it's still a very good, solid number of grafts. However, there is one potential issue that I need to make Jamie aware of.
When I was looking at your donor area underneath the microscope before we took the grafts out, and with my naked eye, the donor area looked really good. But when we cut out the individual hairs, we actually saw how very fine they are. When you separate fine hairs apart, it can lead to not getting a really dense result, okay?
I see.
So when I was evaluating Jamie's donor once it was surgically removed, I'm finding that her procedure is not going to be necessarily surgically challenging, but it's going to be aesthetically challenging because her hairs are very, very fine. So when you separate very fine hairs, it limits the density, and so you need to get those hair follicles as close together as possible to be able to create that aesthetic change. Right there is perfection. All right, it couldn't look any better if I did it myself.
Amazing.
Everything looks perfect.
We were able to recreate the natural feminine curved hairline, able to get the entire recession area, the middle, and then leading into the top area where it's blended with the existing hair.
I see.
A very successful surgery in being able to completely address the area that had no existing hair, which is the area of most concern.
Right.
But the top and back that we didn't get to has existing hair in it that we're just going to maintain with medical therapy and try to stimulate with other treatments.
Looking at what she did and what I have now is just unreal. My only big concern now is that I can't wear a wig for 4 days, so I'm gonna be walking through the airport on the way home without one on, and that is incredibly nerve-wracking, but worth it.
So we're gonna get you up and get you changed back into your clothes.
Absolutely.
All right, very good. When Jamie comes back in 8 to 12 months, I'm anticipating on seeing a large amount of hair growing in that area where she was totally bald. She will no longer be bald. Well, Jamie, you did it.
I did.
You survived. Yeah, we did it. We did it together.
Thank you so much.
It was a pleasure, and if you need me, you call me.
I think that when I look back at this moment in 5 years, this is going to be the turning point of the rest of my life. Like, everything from here is the new and real me, and everything before was a bit of a fallacy. Weirdly enough, this is the best hair day I have ever had.
So I'm gonna be seeing Jamie again today. It's been 8 months since her surgery. So I'm really excited to see what her growth is and how it's progressed. We are seeing Miss Jamie today. Hey, Jamie, how are you?
I'm well.
So good to see you. Wow, all right, this thing worked.
When I was at my most bald, I had lost 70% of my hair. And now I have the most hair I've had in my entire life.
You've got an established hairline now, and you had your little forelock growing in there before, but we've added to that. And now we're getting to the point where we've almost got enough growth where we can get you into a stylable hairstyle.
Almost. Today, I had someone actually do my hair. I had stuff put in it and curlers and things like that, and I've never had that happen before in my life.
It can take up to 14 months before all these grafts kind of mature and settle in and reach their full potential. So the early results that I'm seeing at 8 months is very, very promising. And so I'm very pleased with where we are with her progress at this early stage of her transplant procedure. So we're gonna plan for letting this continue to thicken up, grow more. We'll reevaluate at the 14-month mark, and then we'll maybe plan for doing another procedure to go in and thicken up the hairline zone and give you more density in the areas where it was the thinnest. So sometimes it takes more than one procedure, especially with very fine hair. I've evaluated, her donor area again. There's good scalp elasticity, which gives me the ability to go back and do a second procedure to get her even closer to that full head of hair.
I have to thank you so much. Going through all of this is just getting me closer to being comfortable with myself in a way that I honestly didn't expect that I would ever be able to be. And that's an incredible feeling. Since I've had this hair transplant, I've been able to see who I would be with hair. And that's been something that I never thought that I'd have.